How many people can wake up in the morning and feel empowered to get knowledge to help their bodies feel and perform their best? Well, that's how I feel today, because every time I have the opportunity to sit down and have a conversation with today's guest, I feel powerful. Dr. Brad Watts has a fascinating and uncanny ability to explain highly complex topics of body science in ways that we can not only relate to, but we can action to. Dr. B, welcome to the show. Thank you so much for being here.
Ms. Cullen, thanks for having me. Good to see you.
When you agreed to sit down with me, I was thrilled because I wanted to share your knowledge not only with my clients, but also for anyone out there looking to improve the health, energy, and performance for not only themselves, but for their animals. So for those of us that have not heard of you, tell us a little bit about your background and what your passion is with regard to health.
Yeah, certainly. So I'm a functional medicine provider and a practitioner of clinical nutrition. So I'm an expert in those fields. And right now I am the director of clinical applications for a company called Biogenetics, which is in the nutraceutical marketplace. And so I get to be busy providing solutions and developing solutions for people all over the world. So it's pretty fun.
That's amazing. Well, for those of you who don't know about me, my name is Sierra Cullen. I am the owner of Animal Pulse Therapy, and the focus of my company is to deliver PEMF technology to the body. PEMF stands for Pulsed Electromagnetic Field Therapy, and what it does is it basically creates a magnetic field around the body and sends pulsed energy all the way down to the cellular level, into the cells. This is called cellular exercise. So just like you get up in the morning and you exercise your body, your cells can do the exact same thing. Now, a few amazing things happen at the beginning of this process. First of all, that electric energy is able to detoxify the cell. In other words, it's able to get all the bad stuff out and be able to be flushed through the body. And secondly, it's able to nourish the cell by bringing in oxygen and nutrients. Now, when this happens, it optimizes function of the body because energy, cells with high energy are healthy cells. By contrast, cells with low energy are associated with injury, pain, and dysfunction. So I am able to work on anybody, whether it's a championship barrel racing horse or an elderly Cocker Spaniel or your cousin Vinny. Because a body is a body and the processes work the same way on that cellular level. So Dr. B, enough of the technical stuff. Let's get to the fun stuff and start breaking this down. Talk to us about the importance of cellular detoxification. So we hear this word detox all the time, especially for those of us who ever had to go to a family reunion or had to lose 10 pounds fast before going on a diet. I think we've all been there. It's a multi-billion-dollar industry, particularly within weight loss. But what happens when we are toxic? So why do we get toxic? And what happens when we stay toxic? In other words, what are the implications to our body being toxic, both in our daily lives and in our health long term?
Absolutely. There are a couple of things that you'll want to remember about toxicity. Number one, it can either be from production of chemicals that your body's producing normally, but you just can't get rid of them. Think of things like hormones, so estrogen, testosterone, etc. The second thing, you can have external environment affecting your internal environment. So the air you're breathing right now has mold in it. The air you're breathing right now has toxins in it. And your body's ability to deal with those toxins and that toxic load is ultimately the bridge between a healthy you and a sick you, and vice versa. So you have three main detox organs in your body, and or three that you'll participate with on a daily basis. You have your liver, your kidneys, and your skin. And your lungs do a little bit as well. And if we're talking about like equine patients here, massive lungs, you have massive detoxification taking place there. But when one of those systems begins to dysfunction for a variety of reasons, maybe it's overuse, maybe it's undernourishment, sometimes it's diabetes, whatever it might be. When we have one of those systems that begins to downregulate itself, there's a burden placed on the rest of them, and it usually doesn't go very well. So when you see somebody that has a decreased energy output, they're just tired all the time, right? Sometimes you see that with especially chronic disease patients, but they're fatigued. Usually that fatigue is a protective mechanism. It's telling you there's a problem, and the problem is almost always some form or a function of detoxification is not happening appropriately. So being able to maintain these systems is ultimately the goal, and that's what leads to longevity. Like I have 3 little kids, right? And you can tell that their detox systems are functioning real well because they have tight skin. It's smooth. It's beautiful.
Don't we all wish for that long term? Yes.
Right. And then as people age, what happens? Their skin begins to get a little bit more wrinkly. That's a reflection of what's happening to them on a cellular level. Right? And maintaining proper cellular health is going to allow you to obviously maintain your physical health, but you see that as a reflection here as well. So it's pretty cool.
Wow, interesting. So you had mentioned type 2 diabetes, which no one knows more about type 2 diabetes, in my opinion, than you do. You educate medical doctors all over the world about the implications of this disease, and it's a huge pandemic in our country. I recently came across some fascinating information about the electrical charge of type 2 diabetics. And it basically said that when we are born and when we are young, our body naturally pulses. We get energy from things like spring water and the earth and everything else. And that pulse rate starts at about 3 to 5 times per minute. And as we age, it slows down some. Type 2 diabetics pulse at a rate of 1 time every 10 minutes. Let me repeat that in case you missed it. When you're young, the body pulses at 3 to 5 times per minute. Type 2 diabetics pulsing at 1 time every 10 minutes. So how is disease directly related to low electrical voltage? So we're going beyond just, I feel lethargic, I feel tired. Oh my gosh, we've gotten the body to the level where the energy is so low where the body systems are breaking down.
Yeah, you can't maintain it at some point. What happens is, let's talk about how you create energy first. Okay, so you breathe in oxygen, you eat food, your body mashes the two together, and you exhale CO2. Okay, you're creating that energy in that process. It's called ATP energy. A side effect of that is the production of something called ROS. Okay, follow me on this because you've heard of this before. It's called reactive oxygen species. Have you ever heard of a term called free radicals?
Sure.
That's what that is, free radicals. Free radicals are an electrical charge that are produced as a side effect of creating ATP energy, okay? So you breathe oxygen, you eat food, you get energy, and we create these free radicals that are essentially destroying your ability to maintain cell health, okay? Those are a form of basically toxin buildup. When your body can't deal with that free radical buildup, it begins to shut the doors to the cell, which means it doesn't allow blood sugar into the cell because the cell would rather live a really long time and be like 40% functional than be dead. Okay, your body's built for longevity. And so when you're like going through this process of shutting down the energy centers of your body in order to live a long time because you're programmed for longevity, okay, what begins to take place is people become fatigued, tired, overweight, depressed, right? People end up in a position where they're like, why is this happening to me? What is going on? But your brain is programmed for longevity, and it would rather be fat, like an overweight scenario, right? Fat in the cell, tired, depressed, fatigued, sick. It would rather be all of those things than dead. And ultimately, that protective mechanism is what's at play when you see this. So like the ability for me to wiggle my fingers, that's electricity. For my eyes to blink, my heart to beat, for the words coming out of my mouth right now, that's electricity communicating to you. And to the extent that you have that vibrancy available is to the extent that those cells are going to continue to participate with you.
Fantastic. So let's move on to happier topics. Instead of us wanting to be undead or wanting our horse or our dog to be undead, let's talk about the reason why we're all here. Tell us about how the body has the miraculous ability to heal itself on a cellular level.
It is miraculous. It's amazing. The reason why we don't really think about it is because we take advantage of it on a daily basis. Like if I get a cut on my finger, right? How long does it take that cut to heal?
Right.
Maybe like a week if it's a bad one.
Right.
Right. And in that instance, what's healing the edges of that cut together is that inborn electricity, right, coordinating with all of the different cells and all the different processes that go on in the body, healing the edges of that cut together. Same thing happens with a racehorse that's been fatigued, overworked. Same thing happens with, your favorite dog, right? If it has an infection, right? Something like that. Same thing happens is that electricity begins to coordinate cellular function and allow the edges of that cut to heal together. Now, one of the problems that shows up is that over time, right, people's ability to heal lessens. Like my 1-year-old will heal the edges of a cut together very quick compared to like my 94-year-old grandfather, right? Like it takes him a while to heal. Whereas my 1-year-old, next day, it's like there's nothing even there.
Right.
And the difference between the two is the amount of electricity or the body's ability to hold electricity, if you want to think of it that way. Right, so remember I said, wiggling your finger, blinking your eyes, healing the edges of a cut together, that's all electricity. When you look at like PMF technology, one of the things that excites me is that you're able to take electricity, electromagnetic pulses, and focus them on specific regions that don't have the capacity to hold, follow me on this, they don't have the capacity to hold your own electricity long enough to heal. Yeah. It's amazing. It's like having an extension cord that has chunks taken out of it versus being able to repatch that extension cord and it's working appropriately, if that makes sense.
Absolutely. I really wanted to touch on what you were saying about the cut because it brought me to a really interesting component of PMF therapy, and that is that it actually has the ability to separate red blood cells. So if you actually look at someone who is toxic, and it's not just from food or pollution, you can actually get toxic from electric energy all around us. Now, there's a big difference. I won't get too technical on it, but PEMF energy, electricity, is a different type of the energy that makes us toxic, okay? But can you talk to us a little bit about why it's important for red cells to be separated? Because when we're toxic, those red blood cells tend to get all clumped together, and the more toxins we're exposed to, the more they get clumpy. So tell us why having those red blood cells separating and partying and moving so fast and fun through our system, tell us why that's important, please.
It's kind of like traffic. Right. So I'm sure you live in a metropolitan area. I know you do. And what happens is every day at about 8:30 to 9:30, right, everybody that has to go to work is on the road. Right. And even though the speed limit is 70 or whatever it is in your area, right, everybody's going about 12. Right, because the volume of traffic on that interstate or on that highway is larger, right, than what is safe to travel at 70 miles an hour, right? So if you got 3,000 cars out there, you can't have 3,000 cars going 70. Okay? However, you could have 8, you could have 20, you could have 100 going 70 miles an hour, and everybody's fine with that, right? But when the traffic increases, things begin to move slower. Right? When mass increases, things will be able to move slower. Like you look at athletes in like a 340-pound lineman for a football team, he's a lot slower than the 200-pound running back.
Right.
Okay? And it's because mass usually necessitates slower movement. Well, it is that way with hemodynamics in the bloodstream. It is that way when you talk about red blood cells. When they begin to clump, when they begin to move as units rather than as the red blood cell it was designed as, it starts to move slower. Electrical current follows that same pattern in the bloodstream. It's kind of amazing if you look at it because it has to have the right consistency and the right viscosity in order to send the right current through it. The same way that like your internet is not LAN or LAN internet anymore. It's fiber optics, because a different consistency of the cable allows a faster transmission of electricity. It's the same thing when it comes to red blood cells. So traffic or the electrical cables, like, you can get the idea of it here by understanding that there's an optimal form and function. And when we stray away from that optimal form and function, dysfunction starts to show up. Disease, fatigue starts to show up.
Interesting. Next, I want to talk about performance, because many of my clients have either professional or amateur competitive athlete animals, or they are athletes themselves. I'm sure there's a lot of you out there that have this animal that has the best bloodlines and the greatest training, but you can't quite get them to the next level of where you want them to be. How does PEMF improve the athletic performance in the body?
So really it's about output capacity. So if you have an animal that's capable of running, at X miles per hour, let's say a racehorse, okay, at X miles per hour, based on its bloodline, it should be, right here's your expectation, but it's operating at a B- level right now, okay? You have to ask why. And usually it has something to do with the free radical damage that I told you about previously. That free radical damage deteriorates cell membranes. When a cell membrane deteriorates, it's like taking insulation away from an extension cord. Okay, you cannot send electricity from one end to the other as fast as you could, as it would be, when it's insulated. So when you have a horse, let's say, that does not have appropriate cell membrane integrity because of the free radical damage that I mentioned, we end up in a position where those muscles can't fire the way that they're supposed to fire. The oxygen and the glucose do not move into the cell the way they're supposed to move into the cell. We don't have that electrical stimuli. And so you might have, a world-class horse from a genetic perspective, but because of the lifestyle and environment it's been put in, that cell membrane begins to deteriorate. It decreases the ability for the brain to connect to the muscles, right, to move that animal in the right direction. So what do? You have to be able to maintain cell membrane health, and that's where the PEMF technology comes into play. If their own electricity that animal is generating can't heal the membranes fast enough, right, to keep up with the environmental exposure or the workload that's put on it, then it requires an enhancement or like a bringing up of that electrical conductivity, and that's what the technology offers. It's pretty amazing if you think about the minute mechanics of it.
It's unbelievable, and don't take my word for it or even this genius's word for it. This is something that has been in the horse racing world particular for years, although we work on all different types of equine and canine athletes. But there are numerous examples of Kentucky Derby winners that have done amazing with this. It not only allows them to run faster, but their bodies are able to optimally move the way they need to, whether it's a hunter jumper that can't quite get their bottom end up high enough at times, whether it's a barrel racing horse that needs to be able to turn a certain way. It's really about just optimal function, the way their body was designed to be, correct?
Absolutely. So one of the things you see in athletics, whether it be horse racing or, people riding bikes for the Tour de France, stuff like that, is this concept of blood doping. Okay, I want to talk about this real quick. So what happens is they're banking on the factory, the power plant, the engine of the body being normal. So what do? They increase the ingredients that go into it, either oxygen or blood sugar or hormones, right, that tell the engine to work harder. The problem is that for most people, it's not an oxygen problem. For most animals, it's not an oxygen problem. It's an engine problem. You want to maintain the health of the engine, and it will use the oxygen, it will use the ingredients of energy, blood sugar, the vitamins and minerals appropriately. And maintaining that engine is really what we're talking about, right? Rather than boosting the oxygen content of that animal.
And when you're talking about the engine, you're talking about the cell. Okay, how interesting that you never hear about this. It's so fascinating. Okay, let's close up. I always say that we need to take a 360-degree approach when looking to improve or maintain our health or the health and performance of our animals. What other actions can be taken to complement or prolong the positive effects of a PEMF regimen?
Absolutely. So remember that when we use PEMF, what we're looking at is changing the structure, like improving the cell structure itself through electricity. And that's more of like a maintenance process, right? We got to ask, why does it need maintenance? Why is it breaking down in the first place? Why is that happening? And usually, almost always, it's some form of genetics plus environment, right? So the environment, meaning the area you're living in and the lifestyle you're putting those genetics into. But if you're feeding an animal or you're feeding yourself food that's not compatible with its DNA, that's a problem. Right? If you're living in an environment that has mold exposure and your body's dealing with some form of like mold toxicity or biotoxin illness, that's a problem. If you don't have the right building blocks nutritionally, that's a problem. And so you start to see why the body would break down, right? And why this style of maintenance process is so important. But there are other things that you can look at: controlling the environment, living a lifestyle that's compatible with health and healing instead of a lifestyle that's compatible with sickness and disease. And it goes a long way for everybody, right? It's one of the few things that are universal in healthcare. Live a lifestyle compatible with health and healing, right? Do what you know you need to do.
And equip your animal the same way that you would optimally want to live. That's what so many of us, we try to do what we feel is best for our health, and we're just feeding our animal just subpar food and supplementation and everything else. So Dr. B, always a pleasure. Please let our audience know where they can find more fascinating content from you.
Yeah, absolutely. We have a Nutrition Hero podcast on iTunes and YouTube. You just search Nutrition Hero, and that'd be the best place to go.
Well, you are a hero for me personally, and I know you're going to touch a lot of lives both here in Southwest Florida and beyond. Don't forget to subscribe to my channel, hit the like button, and tell us what you think, what you've learned, and let us know what else you want to know about PEMF. Thanks so much.